Over the next 5 years, around the world, up to 30 million children will die from preventable causes. Almost half of those deaths will have undernutrition as an underlying cause. In addition, about 180 million children will be born without the protection that iodine provides against permanent mental impairment. Iron deficiency affects more people than any other condition, leading to ill health, premature death, and lost productivity. This especially affects women, particularly during pregnancy, putting them at increased risk of death. These deaths, these risks to children's development, are preventable and at a low cost. The Micronutrient Initiative has the solutions. Micronutrients, vitamins and minerals needed by the body in very small quantities, play a big part in preventing deaths and debilitating illnesses. Micronutrients are a key part of improving the lives of families, communities, and whole nations, and are the foundation of nutrition, which sets people up for life. While the world seeks to push beyond the ceiling of what is possible in our increasingly globalized world, we so often forget that we must raise the floor, too, so that everyone can be a part of it. Right now, despite the amazing progress that has been made, we are still leaving millions of people behind every year, and that is not okay. The fight against poverty cannot be won while entire generations are still being born stunted, malnourished, and with their development potential impaired because they don't have access to good nutrition. They are the producers of tomorrow, the consumers of tomorrow, and the innovators of tomorrow. They are the Gandhis, Mandelas, and Beethovens of tomorrow. We need these people as much as they need all of us, because without their full potential, we all lose. Through our work with governments and partners, our ability to provide low-cost, high-impact solutions, the Micronutrient Initiative is working to make sure all children can be born healthier and reach the starting line of life. When I first learned about the MI, I could see the scale of the impact it was having. Working with governments and building strategic partnerships, but the potential for additional impact was also very clear. Every year, MI successfully reaches millions through its low-cost programming, investments in health systems, and its ability to work across sectors, to bring everyone to the table and provide solutions that work. In the past 5 years alone, we have saved more than 1 million lives and protected 30 million newborns against mental impairment. Despite these successes to date, the world is still leaving so many behind. Babies, young children, and women, they continue to suffer because they don't have access to life-saving vitamin A and zinc to boost the immune system or iodine for proper brain development. Millions continue to suffer from iron deficiency anemia. At MI, we want all children, no matter where they are born, to have the opportunity to survive and thrive and live to their full potential. And we want their mothers to be healthy too, because it's hard to have one without the other. Everyone, no matter where they are born, must have the support they need to get to the starting line. Canada's support for MI is an essential ingredient in the impact we're having. Canadian investments in maternal, newborn, and child health have led the world in reducing preventable deaths, especially in its commitment to nutrition. MI is proud to be part of that tradition of Canadian innovation to reach those most in need. What is particularly exciting about MI's work is that we are at a crossroads where we have never before seen the level of interest and political commitment for improving global nutrition. The time is now to seize and expand that momentum through the Scaling Up Nutrition movement and through powerful commitments from governments, donors, civil society, and the private sector. Through our ability to forge partnerships and create new opportunities, we are poised to end hidden hunger. The strongest part of any health system is the immune system, as well as the resilience of the people in it. The MI is working to strengthen both so that everyone can get to that starting line.